Hello everybody, welcome to Innovations in Health. John DeShula with you, and we have an innovator in dental health, Dr. Grant Lemke, who is here from Heartland, Wisconsin. Doctor, the mini dental implant technique is such an innovation. Welcome to the show.
Thank you. Thank you for having me.
You have some models in front of you, and if somebody is wearing a denture or somebody has some mini dental implant needs, show us how that would start if you are a denture wearer.
Well, John, many times the people who have upper dentures are quite happy with them because they have some suction, but then things can happen where the ridge changes with time and they need to have a more stable denture. And implants are an option for them, but now mini dental implants are actually a less expensive, less invasive, more comfortable way of stabilizing an upper denture.
So it snaps right in place, and we'll get into the technique as to what it is, but I noticed on that particular example, the palate is out so that you can now maybe get your sense of taste back.
Yes, you're right. In this case here, we have 6 implants and a denture, and we can do this with an existing denture. You don't even have to have your denture replaced, and it'll snap in like that.
Snaps right in place, so a great sense of security. You know, a lot of people, we talk a lot about this on Innovations in Health, you know, the denture kind of slides around a little bit on the gum, and you've got that goop that tries to hold it in place. But the mini dental implant, you have that titanium post.
Yes.
That we'll see, and that titanium post, and then the denture locks it in place. So it really is a secure way to have your teeth back.
Yes, also what's interesting about this is, let's say someone has an existing denture and they'd like to have it stabilized, and we can do this for them and make it so it's tighter. But we can also then, at some point in the future, while they're still wearing this, they can say, well, I would like to have something that's more natural. So one can go to a bridge like this, where you use the same 6, and we can make a bridge that snaps on like that.
So that's like a full set of teeth.
That's like a full set of teeth, and the palate is completely open, and you're basically getting your youth back when it comes to having your teeth the way they used to be. And as you can see with this, you use the same 6 implants, and that goes on like this. And you can say to yourself, well, that seems to snap on and off, but actually only the dentist can take it on and off. If you want to have something that is actually fixed, you'd need more implants, something like this, and that would go on there and completely get cemented on, and that would not come off. And then you really have the feeling of being back to having your own teeth, even though this other one that you can't take off would be similar feeling.
So let's talk a little bit about if you have the need for a mini dental implant, and it's just a few teeth. There's an example where you can have just some teeth that are in the back, or even a single tooth.
And I can tell you, it's really kind of exciting, because in the past, if someone would lose a front tooth like this, it would be very difficult. I'll maybe give you an example.
Sure.
I have a patient named Linda who came in, middle-aged woman. She had all of her teeth in pretty good shape, but her front tooth had been root canaled in the past, and it split vertically. And she came in and she's like, what am I going to do? I can't be without my front tooth. She was in a job where she was visible talking to people. She just was in a panic. And in the past, what a dentist would have to do is make an impression, send it off to the lab, have them make what's called a flipper, or a one-tooth partial, put that in there, let it heal, have her come back after it's all healed, make a bridge where you would have to cut down the teeth on either side, and it was going to be horrible for her. But what we were able to do is gently extract the parts of the tooth that were left, place the implant, place a bone graft around there, and the beauty of these mini implants is that you can put a temporary cap on here that looks exactly like the tooth was before we started. So I made her that, and so she walked out the door an hour later with a fully functional looking tooth. We let it heal for about 6 weeks, came back, it all looked just fine. We scanned it into our computer and made her a crown in less than 40 minutes.
And all of this happens right in your office.
Right in our office.
So,
yes.
You know, if you want to go to see Dr. Grant Lemke, you go to Cloud9 Dentistry at 3079 Village Square Drive in Heartland, Wisconsin. So you're just about 25 miles west of Miller Park.
Correct. It's an easy freeway drive to the corner of Highway 83 and 16, and we're easy to find in the Village Square Shopping Center. And there's another interesting case that we had. An individual came in and he said to me, I want all my teeth extracted. Just take them all out. And so I said, well, you know, first we have to examine everything and see what you have going on. And he was right. He had had a lot of bad experiences with his teeth, you know, and they had abscessed and broken and all these things. And so we said, okay, we can agree with the upper teeth coming out, but he still had 7 unblemished teeth on the lower. So we saved those 7 teeth. And then he had a denture made while the area was healing. And then we did exactly what you see here with the 6 implants, and now he has a denture in there that snaps in, and he likes it very well. In fact, I believe that he's going to come back and have one of these other kind of bridges done at that point, but that's an option for him. There's always options with these mini dental implants, because they are less invasive and they're not as uncomfortable. The healing time is less, fewer visits to the dentist, and the cost is substantially less than the heavy-duty, larger implants that have been traditionally done.
We should talk a little bit about that, because the older implants that people might be familiar with took a lot of time to get in place. The drilling was a lot more significant. The bone had to be there. It took months and months, but this is a much more compact process.
Let's just say for relative size, if you're going to make a 5mm diameter hole and you're going to make a 2mm diameter hole, when one is talking about the human mouth, you would much rather have something that's 2mm than something 5mm.
Much smaller, and those are titanium posts. We should mention that
Yes.
That's something that goes right into the gum, so if there is some bone there, that's terrific, but if there isn't as much bone, it will still create a secure mount.
What happened, the original implants would have to be that large because there was a hole down the center with a screw that would hold an attachment that would go on top of it. So you had a large surgical procedure, you had an attachment put on and a screw put on that you would tighten down, and on that, all that, you would place a crown or a denture or something. But it was a very complicated situation. It was a little difficult to get enough bone, so a lot of times people would have to have bone grafts and wait 6 months, and then they'd have the implants and wait 6 months, and it was very time-consuming, costly, uncomfortable. There were a lot of difficulties with it.
So now the mini dental implant has replaced that. The mini dental implant is, as Dr. Lemke mentioned, less invasive, less healing time, less visits to the dentist, less discomfort, less cost. And let's talk about that, because you have a free consultation that you'll offer a patient who will come in, and you will discuss, I would think, whether they have a denture or not, or what their need would be. How do you consult with the patient? What do you generally review?
Well, what somebody would expect is that they're sitting at home right now, or they're maybe they're on the internet, and they see this discussion going on. And what they need to do is call our office at 262-367-4245 and tell the receptionist that you're interested in mini dental implants. And then what she will do is she will book you an appointment where you will come in. And what we will do is sit you down in a conference room similar to this, where we will discuss this. What's your need? What's your want? What's your chief complaint? You know, what don't you like? And then from that point, maybe we say, let's go find out some more information about your teeth. Let's find out what's going on. So in this free interview and then examination, we will have a 3-dimensional x-ray taken of your mouth. So we can actually see this, we can basically see what your jaw looks like under the gums and how much bone you actually have there.
And that imaging that you can do is right in the office.
Correct.
And that's an important piece of this, because you will be able to, in a 3-dimensional look, show the patient how this implant will interface with their current teeth.
Correct. Then we go into the operating room and just look at their teeth and look at what they have. Perhaps in some cases we might take some intraoral pictures, which is all included in the free examination, and then take all that information, sit down with the patient and review it with them, and then tell them what their options are. They can do nothing, or they can do the denture that we showed here, which has 6 implants, or they might say, I don't want anything like that, I want to have something that's cemented like this, whatever they would like to have. And they can decide what they'd like to do, and we will give them an estimate of what it's going to cost them, and then they can do with it as they wish. If they wish to shop around, that's fine, but if they'd like to come and see us and have to take care of it, we'll be glad to be there.
Well, and you'll work with them on costs.
We have an individual who has ways of setting up care credit or various other financing options so that they can have this affordable, so that they can use it. And a lot of times people say, well, you know, of course implants are very expensive, but again, the mini implants are less expensive, but they still cost a significant amount of money, but it gives them a quality of life and a lifestyle that they didn't have before.
Well, that's what we were going to say. This is an investment in an individual's health, because, you know, your dental health can be tracked back to so many pieces of your whole body. And if your dental health is not there, some other pieces of your health might falter as well. And you'll be able to eat better. You'll be able to dig into a piece of steak, a corn on the cob, an apple, you know, all the great fruits and vegetables and food that Wisconsin is famous for. You can indulge and enjoy, and your quality of life gets so much better as a result.
Right, and unlike teeth, the titanium does not suffer from decay or rust or anything like that. And the crowns that we make in the office for any of, like an individual or a bridge, the high quality porcelain crowns that I create for people, I guarantee for life so long as the patients come in every 6 months for their checkups.
You were reading my mind, Dr. Lemke, because I was going to talk to you about the care of the mini dental implant.
Well, the care is very simple. If you are used to flossing, or if you're not used to flossing, you have to floss. So there are special things that we give the patients along with this so that they can get underneath their bridge and be able to floss here. And on single teeth implants, where you have similar to what we have like here on this front tooth like this, it's just a simple matter of getting the floss down in between the teeth and also wrapping it in a C shape around the lingual and also around the facial of the tooth.
And proper brushing and a water pick is important.
With everyone who has an implant, where they have one or more implants, we provide them with a free water pick.
That's an important piece of the
Yes,
oral health component.
We want them to maintain these things and have them for their whole life long, because as people age, eating and walking and not falling down, and these things sound so simple, but they're really very important, because you fall down and break something and now your whole life has changed. And if you can't eat, your life has also changed quite a bit.
And do you find sometimes, Dr. Lemke, that people just sort of accept the fact that, well, this is the card that these are the cards I've been dealt with whatever the situation is with my teeth, and they sort of just kind of go along to get along. And what we're saying here with the mini dental implant is you don't have to live like that. This is a change that you could afford, that you should invest in yourself no matter what the age. It could be someone who is a senior with a denture, or somebody who is more middle-aged, or even somebody younger who's suffered maybe a sports injury or some other issue with their teeth. It's something across all ages.
It's very interesting because it is something that goes through all different ages. I've worked on teenagers and people in their 20s who maybe congenitally are missing a front tooth, a lateral incisor, and they've had to wear like a orthodontic retainer, and now their teeth are all straightened, and now they take the retainer out, and obviously they're missing these teeth. And historically, you'd have to carve down two very good teeth to make a bridge, and it wouldn't be anywhere near as nice looking as having a single implant that matches perfectly. So we've had situations like that, and we also have situations where a woman brought in her mother who was in her 90s, and she said, you know, we have to do something about my mother. It takes 4 hours for her to eat. And all she had was an upper denture and no teeth on the lower, so obviously this woman had a hard time eating.
Sure.
So I suggested everything that they could possibly do, and they said, well, we are limited means, and the woman said to me, I'm not going to live that long, and the daughter said, well, it takes too long for you to eat, Mom. We got to do something. So the compromise that they did was that they said, well, let's put one implant in on one side, so at least I have a molar to eat on one side. So we did. We put it in. The mother was happy. She didn't have any pain. About a month later, I called back and I said, well, how's it going? She says, well, it used to take 4 hours. Now it's down to 2.
There you go.
There, things are better. So then they decided to have another one done. Now it takes mother an hour to eat. So if she would have more teeth, she could probably be done in, you know, less time. But this is all she wanted. You make accommodations for what people ask you for. You don't force things down their throats.
And you work with your patients.
Absolutely.
And here in Wisconsin, you are able to work with people on many levels, including the sedation part, because some people just are afraid to go to the dentist. It's sort of an age-old superstition, but they shouldn't feel that way. But if somebody has a need for sedation, you can offer that as well.
Yes, for about 10 years now, what we've been doing is using pills to lightly sedate people. So there are about, they figure, 20, 30 million people in the United States who are so afraid of going to the dentist, they won't even think about going. I have patients who have sat down with me in my conference room, and as we're sitting like we're sitting, they just start to quake, and then they jump up and walk out and run out the door, and then they come back later on.
Well, and so maybe they had a bad experience years and years ago, and it just is embedded in their mind, but people should get over that because it's very important that they have their dental health. And with all the innovations in health, which is why we're here, and the innovations in dental health, the mini dental implant takes that to a whole new level.
Yes.
Well, we should talk a little bit about Dr. Grant Lemke, the person, because Dr. Grant Lemke has done so much in the community. You're a man of faith. You've worked with an apostolic church that you should tell us a little bit about, and a mission to Haiti.
Yes. Yes. Actually, about 5 years ago, I belong to the local Rotary Club, which is in Heartland, Wisconsin also. And of course, the premise of Rotary, it's a 100-year-old service group. Is it the truth? Is it fair to all concerned? Will it build goodwill and better relationships? Is it fair to all concerned? So we have a vibrant group of people out there who are interested in helping people who need help. So they felt that a dental clinic was needed down in Mirebalais, Haiti, and my oldest son went with me, and he was the triage doctor to see who had to go first, and another dentist from Sussex nearby and I and our 2 assistants went down, and all we did is just take care of the people that we could see in the week that we were there, and then we had scheduled other people, and my son stayed the whole time, and we really were happy to help those people out.
That's an amazing story. How long have you been a dentist, Dr. Lemke?
About 35 years, and I love every minute of it, and I'm looking forward to even more because the mini dental implants are just so life-changing for people.
And on top of that, you do other dentistry as well. So if you come to Cloud9 Dentistry at 3079 Village Square Drive in Heartland, Wisconsin. And by the way, the website is cloud9dentistry.com, cloud and 9 being the number 9, so it's easy to remember. You have other things that you can do to people as well that will help them in their dental health.
Yeah, absolutely. We have a CEREC machine, which is a opportunity for people to have any kind of crown restoration or bridge. Well, we don't do too many bridges anymore because of mini dental implants, but any restoration like that we can do while you wait. You only have to be numbed up once. You don't have to come back for a second appointment. You don't have to have the gooey impression material put in your mouth. It's all done by a 3-dimensional camera, done on a computer screen where things are blown up 30 times normal, so we can see extreme detail that we could never see before. And then it's milled in our office. We try it on, make sure that it's the way it should be with an X-ray, and then put it in some cases we have to put the crowns through a furnace. In some cases we have to add some color to the crowns so they match. And every one of my patients who's had a crown done, while they wait, never go back to the temporary and the goo and all the other stuff that goes on.
We should talk a little bit about some of those patients because there's some stories you wanted to share. A patient named Mike who had a good experience. Was that with a mini dental implant?
Yes, that was, I had kind of referred to him before. He is the fellow who came in and said, take all my teeth out. I don't want to have any more teeth. But I convinced him that he had 7 unblemished teeth, and he saved those. But then what he did is in the posterior, or the back of his mouth, he had some missing teeth, or we took out some teeth because they were in bad shape.
And this is important to know because it's just a few teeth that you can do the implant.
Right, and what you have here is what it looks like a bridge, okay? And it has the place for the mini implants to go, and then you would cement this on, and now he has natural teeth on the lower right and the lower left. And like I said earlier, he probably will, since he has this right now, with the 6-on-6, he's probably going to go to one of these where he ends up with something that feels just like the real teeth, because he just wants to be as natural as he can be.
Let's talk about some of the patients that you've treated. And one is a wife who had a very emotional experience.
Yes.
Share that story.
I had a patient who was another doctor's patient for many years, and the doctor retired, and so I acquired this individual. And I said to him, you have this removable partial, which you've been wearing on these upper front teeth, and they were discolored and on an angle that didn't match the way it should. I mean, you'd look at them and it was like, that's not the way it's supposed to be. And I said, are you comfortable with that? And he said, well, what can we do about it? I said, well, we can take the partial, put in the implants, and make 4 crowns for you that would be, that would match the way they're supposed to be. And he said, you can do that? And I said, absolutely. So he came in, had it done, and they looked really just perfect. And he walked out into the waiting room, and his wife was out there waiting for him, and she took one look at him and started crying, and I thought, oh boy, here we go, And she just was so happy that he looked so much better again. And she said, that's my boy, that's how he looked when I married him. So yeah, I'm sure that made his day, and I'm sure that he's getting a lot of kudos from his wife every day for that.
Well, and that's a happy experience.
And
that's one of the reasons that the mini dental implant is so important, because you can bring some vitality back. There could be maybe a relationship that you're in that or maybe getting into a new one or out of an old one, or a new job that's coming up, or some life moment where a mini dental implant will not only help you physically with your health, be able to eat, but the emotional jolt that goes with it and that sense of self-confidence is very important.
I think a lot of people too also just enjoy being able to eat food that they hadn't been able to eat for a long time. I remember my first implant patient that I had back 25 years ago, because I used to do the other types of implants too. He said, look, all I want is to be able to eat a corn on the cob again before I die. Well, you know, that's not a real high bar to try and make, but it was something that we were able to do for him. And that was what kind of got me into the implants, because it's like, you know, you're really changing people's lives.
And even after 35 years, Dr. Grant Lemke practicing and working as a dentist, there's changes, and now you're getting learned and skilled in all of the mini dental implant techniques, the very latest cutting edge techniques that you're bringing to the people of Wisconsin through your office right there in Heartland.
There are so many wonderful things that are coming along. I wish I were younger to be able to continue practicing for forever, really. There's the latest thing, you know, there's a lot of people who have restorations and teeth that break a lot. And I've just completed a course in injecting Botox into the jaw muscles to decrease the power of people's jaws so that they don't create the pressure that can break their restorations. It's a very important thing. People who wake up in the morning with sore jaws and they have their teeth aching, and when they clamp down like that at night, it also creates a lot of pressure in their temporomandibular joint. And all of this can be alleviated with just some painless injections on the outside of their mouths and maybe on the side of their head. And it's amazing the things that we can do now that we're never heard of before.
What was that joint? The
Temporomandibular joint, TMJ.
You learned something new here on Innovations in Health.
Yes.
But we're here to talk about the mini dental implant because it's so very important. Ladies and gentlemen, if you're watching this and you're thinking you want to go and see Dr. Grant Lemke, you should. If you're in Wisconsin, if you're anywhere in the area, you're 25 miles, you say?
25 minutes west of Miller Park.
Miller Park, and
yes.
So that's not far. It's a landmark. People should be able to find you at 3079 Village Square Drive, and that's in Heartland. And of course, the website, very, very easy to know, cloud9dentistry.com, and the 9 being the number 9, and your number 262-367-4245, 262-367-4245. The mini dental implant, everybody, 5 times less invasive, less healing time, less discomfort, less visits to the dentist, less cost, and something it's American-made product, FDA approved, right in your office. And I think that's something we should pick up on, because after we discuss that, we'll show the models one more time. But this happens right in your office. There's no outside medical area that they go to. Everything happens right there in Village Square Drive.
Correct. And when somebody hears the word mini, sometimes people wonder, I wonder if this is going to last. Because, you know, am I getting a Mini Cooper instead of a full-size car?
Sure, they last.
They last, they do last. But the reason it's mini is mini invasive, minimal surgery, minimal pain, minimal expense. That's why it's a mini. The FDA has approved these for being available for restorations and for stabilizing dentures. That's just the name that goes with it. But if they think of it that way, then it's something completely different. It's not that the other ones are bad or ours are good. I will still place the larger ones where I must, but you know, if you have a ridge that's this wide and you put an implant in that's this wide, there's not a whole lot of bone extra to do that. But if you put an implant in that's a diameter that's this wide, you got a lot of extra room and a lot of bone to grow into it. So it's just a new way of doing it that has been tried and true, and it is an exciting thing to be a part of in this day and age.
So let's take a look one more time now. If you have the denture and you want to throw the denture out, you can do that. Or if you have a denture and you want to adapt it to be more secure, show us again how that works, Dr. Lemke.
All right. So let's say you have a lower denture and you hate the thing, and you hardly ever wear it and you just don't like it.
Or you're using that goop to keep it together.
Yes, or both. You hate it and you got the goop. What are you going to do? Well, simply stated, we need to put these protrusions out of your jaw in order to get into the jawbone, and then these become so embedded in there that they are part of you.
And that's the titanium post.
These are the titanium posts. They're a one piece. There's no hole down the center. They're solid. And the tips of these are the male ends, and the female ends are then placed on the inside of your lower denture. And then as you put that in, that lower denture in, it makes that snapping sound when it goes to place. And now you can bite sideways, this way, that way. You can chew all sorts of different directions. You can have softer foods, and this thing is not going to move.
Rock solid.
Rock solid.
Then you have another example.
Of the upper would be the very same. Again, here we have 6 implants and 6 of the females in the inside. So all we need to do is put these in, locate the place on the inside of the denture, put new acrylic in there so that those get bonded in, and again, it makes a clicking noise and it goes inside there. If somebody wants to have completely natural teeth again, we have either this option with the 6 implants, with the hard zirconium or porcelain bridge. This you cannot take out, but I can take out. You don't want to take this out because people invariably drop it, and then it chips and breaks, and that's not good. So we do it so that we're responsible, and that gets then rechecked and put in periodically. Or if you don't even want to ever have it come out, there's a permanent bridge like this where you have to have more supporting implants, and this gets cemented on, and it stays right where it's supposed to stay.
And you can even do a single tooth or just a few teeth on the side.
Right, you can do a single tooth like this. So let's, I think of another patient that I have. He's missing a tooth over here and a tooth over here. And okay, he has a partial right now, a removable partial that he takes in and out. So we take the partial out, we put an implant in here, we make him a crown, we put it there, we cut the partial, that tooth out of the partial, and he still wears the partial until he can have the one done over here. So, you know, in years past, people would have to surrender their partials to have things changed, and it would take time, and so many people would be without their teeth for a period of time, which is socially insufferable.
And now with the mini dental implant, all of that changes because it is absolutely something that's an innovation. It's an innovation in health. It's an innovation in dental health. And it's Dr. Grant Lemke who can do it, and his team at Cloud9 Dentistry, 3079 Village Square Drive in Heartland, not far from anywhere. The website, www.cloud9dentistry.com. The 9 is the number 9, and the number 262-367-4245. Dr. Lemke, we've learned a lot about the mini dental implant. We've learned a lot about you as a dentist. Grew up here in Wisconsin, and
I grew up in Milwaukee on the south side, went to Pulaski High School, Carroll College, at the time it's now Carroll University, and Marquette Dental School.
And you're staying right here in the great state of Wisconsin to help
Yes.
all of us look and feel our best.
Yes, John.
Thanks very much for joining us. Good luck to you.
Thank you very much,
You're
John.
welcome. Thanks for watching.